with Dr. Sierra Windsor, and we're here talking about mold, which is a really hot topic these days. And a lot of people have questions about mold, what mold can do to you, how do you know if you have mold in your system, how do you know if you have mold in your house, how do you know if you're being exposed to it in your work. And we're here to answer some of those questions. So super excited to have you back because it's always a pleasure. Okay. How common is it for people just in general to be exposed to mold, whether that's like in their home or their work or, I don't know, here in the Pacific Northwest, outside, their car.
Cars are a big one.
Yeah.
Very, very prevalent. The question is not if you are exposed to mold or not, because it's inherently a part of our environment and sometimes not necessarily microbiome, but it's a part of what we're exposed to. You can't really avoid it 100%. It's more so if your body has a strong reaction to it or not.
All right, so that's important. So this is not like The Last of Us where like some crazy mold is going to take over our brains and like turn us into zombies.
I mean, some of my patients would probably report that sensation, but not for most people.
So if it's not about how much we're exposed to, how common is it then for mold in our environment to cause symptoms in our body?
Yeah, I mean, amongst my patient population, very common. I think amongst the general population, it's a very under talked about and under diagnosed issue. So, I mean, I imagine a lot of people probably don't feel great in their living environments and don't know why. But amongst my patients that have a lot of MCAS, usually, like a lot of times there is a mold component somewhere in their history.
Okay, so we're talking about chronic complex illnesses. The one of the things we want to think about is mold, right? As potential trigger or causation of some of the symptoms that are happening.
And usually how that shows up in someone's history is maybe they lived in California and they felt great and they moved here and they no longer feel great, which could be from a lot of reasons. Or there's a really distinct timeline of I felt great and then I lived here or I did this and then I no longer felt great. And that is where all the MCAS kind of started for this person.
Yeah, or maybe they like feel terrible all the time and then they go on like a trip and they're like, I felt amazing.
Usually pathognomonic for mycotoxin illness.
Yeah. Okay. What is kind of one of the biggest misconceptions you think people have about mold?
I mean, there's a whole branch of medicine that doesn't think mycotoxins are a problem. They don't think mold's an issue. They don't think it exists.
What is a mycotoxin?
Mycotoxins are toxins that mold species produce. So there's like 5 or 6 big key mycotoxins. They can come from a variety. And like, for example, some molds make multiple mycotoxins.
Now, are these things that they're just like shooting off into the air? Are these things that you have to like rub the mold into your face?
I mean, you can they can come in through food. A lot of it is, like if you have mold in an environment, a lot of it is through inhalation. So they are like little things floating around.
And these are things that molds produce just as like normal like reproductive means, right? Like this is things that help the mold survive.
To my understanding, yes.
Yeah. There's a lot of mold exposure that can happen through foods that are not stored properly, right? Like grains and stuff.
Yeah, biggest ones are like peanuts, nuts in general and grains that aren't stored properly, and coffee, unfortunately, for some people can be a big one.
Yeah, like how the beans are processed.
Yeah, it's usually the storage piece of things like is the problem.
Do you have like a list of like certain types of brands that are less moldy than others?
Well, some brands do, like they will do tests, they'll third-party test for mycotoxins, which is pretty cool. But unfortunately finding, it's a very expensive coffee once it's been third-party tested.
Oh, I believe.
Yeah,
I believe that
but very fancy.
Okay. My coffee is mycotoxin free. Okay, how would people identify whether or not there's mold in their environment that might be causing a problem? What are some like signs they need to look for in their homes and works and stuff like that?
Yeah, I mean the obviously visible mold is a huge piece, and I think understanding the history. So people don't think about this until you ask them. You're like, hey, did you ever have water damage in your house? Like, was there ever like a big leak? And they're like, oh yeah, 2 years ago, like my neighbor's pipe upstairs burst, house got soaked. They cleaned it up, said it wasn't that big of a deal, moved on with their lives. Like, usually they don't think about that as being, okay, there could be mold growth in the inner walls that we can't see, you know, or like the ramifications of that.
Or like that roof was leaking and then we got it patched, but there was water damage.
Yeah, or the water heater, you know, blew up. And
Does it always happen from water damage, or can mold grow from other things that are happening?
It can grow from other things, but I think building wise, the most common I see is some sort of water damage. But technically, I mean, it can come in from other places and colonize. So it can come from other places.
I've heard that paint peeling is like a big sign of potential mold.
Oh, interesting.
Have you heard this before?
I have not, but I'm intrigued.
I'm intrigued too, because our bathroom has like a lot of paint peeling from it, but I think that's just because of a shitty paint job. But now I'm like, shit, is there mold in her? Yeah, okay, so looking for signs of like active mold, but you don't always see it, right? So it has to be found, or maybe like past exposure or something to that.
Yeah, so we can test the body, we can test a human for mold, we can test the environment for mold. The best gold standard way is to take air samples and basically like see if there's mycotoxins in the air, but it can be really expensive to do that. Some of the cheaper options, there's one I really like, it's like a Swiffer, and you literally just dust your entire house and then they test that for mycotoxins. I think that's pretty cool. There's other ones that are even cheaper, probably a little less accurate, that are more like a petri dish that you like leave out for a certain amount of time and they're like, oh, looks what colonized on it. I'm
like nervous to do that in my house. I'm like pretty positive there's like 7,000 microbes just like living in my nasty ass house. What are some of the human ways we can test molds in our body?
Yeah, the best way is through urine testing. So basically, mycotoxins they enter the body. They can have an inflammatory response for a lot of people, right? If your immune system decides it does not like to be exposed to that mycotoxin, it has a really strong immune reaction to it. It can have a lot of symptoms. In a perfect world, it would be expelled through urine, but oftentimes mycotoxins really like fatty tissue, and so they can kind of store and get tucked away. Like your body's kind of like, this is too much. It'll almost try and like remove it from the system and kind of store it. So testing in urine is the best way, to my knowledge, to test for in humans.
Okay, so isn't it true that in a place like Seattle that's like very damp and wet and there's kind of like mold all over, even outside, that everyone, or maybe not everyone, but like a good chunk of the population would have some amount of mycotoxins in their system?
Potentially, yeah. I mean, like, we're all exposed to it at some point. It's more like, is it causing clinical symptoms? Is there, are you having that inflammatory response to it or not? A lot of people don't have a response to it all. And something really fascinating that I learned is that those who are assigned female at birth, our immune systems are more likely to have a reaction to it than male. So I have a lot of patients who like, I see the female in the couple, and they almost have to like convince their husband, like, look, this is what's going on. Like, I'm feeling really sick, and the man's like, I feel fine. Like, what do you mean it's a problem? I feel totally fine.
I always feel fine.
And it's like, yeah, but your immune system is like very different, and we're more likely to be affected.
Well, this is the same for autoimmune diseases, right? Where you're like, we're more likely to have a reaction. And all right, so here's the big question I have for you though, is if we have, say, all this potential exposure, and some people respond and some people don't, how can you tell, like, say, if there's a partner and two pairs of partner, and one person is not responding to mold and one person is, but both of them have mycotoxins, how do you know if the symptoms of that one person who's having symptoms is having symptoms because of the mold?
Yeah, it's a good question. I will say a mycotoxin illness is not usually the first place I look for people in terms of, like, I think also because it's kind of a loaded, like, if you test for that and you find it, it comes with the implication, right, that, like, one, you're going to treat it, and two, you need to make sure that you are no longer living in mold, and that can be a lot to ask of someone if they own a house, like, it's a whole can of worms to open. So I try not to open it unless it needs to be opened.
Because mold remediation is very expensive.
Insanely expensive. And it's not 100% guarantee. It can come back. And sometimes it does. There's an energetic to mold. It likes to follow people around. So I will try and look for other causes of symptoms first. But sometimes if it's very, very obvious, like, yeah, we moved in this house and I have not been well ever since. And I go on vacation and I feel better and I come back and all my symptoms come back. I'm like, okay.
Then it's probably the mold.
It's probably the mold.
Yeah. Okay. All right. So that's fairly helpful. What are some common symptoms that people experience when they are having reactions to mold?
One of the most common ones I see, which makes a lot of sense, is it's almost like localized allergic, like you think about inhaling some, like even a pollen, for example, and like the nasal inflammation, itchy eyes, like that kind of symptoms that happen. And I have a lot of patients that will say, oh, I wake up every morning with like runny nose and sore throat, and I go about my day and it's fine. But then when I go to bed, like every morning I have the same symptoms. I'm always like, okay, well, what are you potentially being exposed to in your house, in your pillow? I mean, people have old nasty pillows all the time.
Yeah.
That always makes me curious, right? Like if your symptoms are worse in a certain location and they get better even throughout the day. But mycotoxins can cause all sorts of symptoms, lots of neural inflammation, lots of brain fog, fatigue. Some of them have affinities for some organs more than others. Like some of them are a little more kidney toxic, some are a little more liver toxic. But think of almost kind of like an MCAS presentation, just like a lot of allergic excitatory symptoms.
And mold can trigger MCAS.
Yeah.
So there's like a big connection there too. Yeah. So anything. It could be fucking anything. Yeah. Okay. How can you distinguish mold reactions from like other types of allergies since they look alike?
It's a good question because even, I mean, a lot of my patients that have mycotoxin illness respond really well to antihistamines and mast cell stabilizers because there is like an allergic reaction component or histamine component to it for a lot of people. So it can be hard to differentiate. I will say if you're reacting to mycotoxins, it's not going to have like a seasonal allergy component. Like, you know, X tree is blooming right now and I have allergies to it. It's more pervasive and persistent than that.
Yeah, so maybe the pattern is different, kind of like you're mentioning, is like it's really bad. Maybe you go away on vacation or something like that, it gets better, or maybe it's like worse in the morning when you wake up and then better throughout the course of the day. And
usually the longer they stay in that environment, they are getting worse.
Yeah.
Like the trend line, the progression is not improving because they're continuously being exposed. And it's really hard you can't do much in terms of treatment if there's that much exposure going on too. It's really tricky. Yeah,
so you can try to get rid of the mold, but they're continuing to get more and more mold, so that becomes problematic. All right, that makes sense. Are there certain types of people who are more vulnerable to mold illness?
It's a good question. I would say if someone's immune system is already a little hypervigilant or hypersensitive, I would imagine they're more likely to have a reaction to it than someone who isn't. It's kind of hard to like classify people as like you're probably gonna react to it.
Sorry, but I mean, like probably more people that have MCAS or more people have autoimmune diseases and stuff. They're just their immune system are already overactive, so they might be more responsive to the mold. Or people who are assigned female at birth, like or if they have like excess estrogen or something to that nature.
Exactly, all the things that we think of that increase our immune system response and inflammation are probably going to also contribute here, right? Because some people can be exposed to it and their body just kind of gets rid of it and they're very tolerant to it and it's no big deal.
Okay. Is there a difference between a mold allergy and a mold toxicity?
It's a good question. I think I would say there is from what I've seen clinically. Like you can have allergies to mold and you can have a reaction and not necessarily like have mycotoxin illness, I guess. Like, I guess what I'm trying to say is I don't really find a lot of use for doing like IgE testing to molds. I've seen a lot of providers will order IgE antibody testing and be like, oh, you have an IgE to this specific mold. That means you must have been, you must have lived. And I'm like, that's like quite the extrapolation to make from that data. And same with like you can test for IgG mold antibodies, but antibodies can stay elevated for a very long time after exposure. And I feel like that's not really, like I would never do mycotoxin treatment based off of the fact that someone had been exposed to a mycotoxin at one point in their life.
How long can mycotoxins stay in your body? Like if you're testing
time.
Yeah. Because they can sequester in the fat and stuff.
Exactly. And that's the biggest question if you want to talk about urine mycotoxin testing is do you provoke it or do you not provoke it? Meaning like, do we want to draw some of those mycotoxins out of that tissue? If you had a past exposure, you're like, okay, I no longer live in mold. Great. But I know it was an issue in the past and still lingering. Then you might want to provoke it to make sure you're drawing it out effectively. Or if you think you're actively living in mold, I mean, technically you probably wouldn't need to provoke it. Sometimes we still do, but yeah, there should be enough floating around to be measured.
Yeah. Okay. That's really helpful. So we'll do a couple other videos too about like how, we go into diagnosing mold illness, but also just like how we even treat it to begin with, which is very complicated.
Yeah. I have one more point on the fact that we live in Seattle, which is
Oh.
a very damp, moldy area.
It is.
I have a lot of patients who live in not damp, moldy areas, and they does not necessarily mean that they like that mold's a 0% chance. Like I've seen it in New Mexico, like places that are very dry that you don't think they can still have mold issues. And the second thing people always say is, "We just bought this house; it's a brand new build." Like, of course, there's not any mold, and I would argue that the way homes are built nowadays are actually probably more prone to developing mold than some of the older builds.
I've read about this because
they're airtight.
Yeah, and the wood is not as like thick and resilient too. Yeah. That's really fascinating.
That's interesting.
Yeah. All right. Well, thank you for that information and for your time and your expertise.
You're welcome.
And we'll keep doing this.